Hi, so what I'm going to do today, I'm going to do an inspection of the thoracic and the pulmonary. I'm going to be checking. So I'm going to go ahead and check his chest. And what I'm going to do first is do inspection first to make sure there's no deformity from inspiration and expiration. Make sure there's no, he's not having any difficulty breathing, any kind of retraction from when he's breathing. As you can see, he's calm. There's no accessory muscles being used at this time. And also, once I'm done inspecting, I'm going to palpate, and I'm going to be touching, and I'm going to do percussion, and then I'm going to go ahead and I'm going to auscultate. Okay, so we're going to go ahead. As I can see, there is no accessory muscles being used. He's breathing normally. Just breathe normal and relax. And so what I'm going to do is inspect anterior and posterior of his chest. As what I can see, he's breathing. I want you to take a deep breath in and out for me, please. In and out. As you can see, they're both symmetrical. There's no problems, no use of accessory muscles. And also I'm checking the back as well. Okay. As I can see, also there's no accessory muscles. I don't see anything that he's using to overexert. So what I'm going to do right now, as I inspect, I'm going to go ahead and palpate. And normally I'm going to start from the anterior, and what I'm going to do is just palpate through. See if there's anything that that is abnormal. And after I palpate, I'm going to go ahead and I'm going to auscultate the anterior. The posterior is much easier to also palpate and also percuss when I'm doing all that. Okay, so I'm also watching to see if they're even breathing. There's no shallow breathing at all right now. And what I'm going to start doing is I like to listen to his lungs at this time. I'm going to make sure it's not cold. I'm going to have you take a breathe in. Nice and clear. Over here again. Okay. Take another deep breath in, please. Deep breath in and out. Take a deep breath in, please, and out. And I'm checking the lateral. In again, please, and out. And in and out. I just went ahead and auscultated anterior upper and lower lobes, and no adventitious lung sounds. They're both upper and lower anterior. They're clear. I'm going to have you also turn around, please. If you're able to turn around, I'm going to be checking your back all the way so that way they can see your back, please. I'm sorry. I need to face your back all the way through. Thank you. Maybe we can sit you down in a different chair. So I'm also inspecting, making sure there's no abnormalities. Take a deep breath in and relax. As you can see, there's no accessory muscles, nor upper accessory muscles being used at this time. Do you have any problems breathing?
No.
Do you smoke?
Yes.
Okay. How many times do you smoke a day, hon?
3 to 4 cigarettes a day.
Okay. Any shortness of breath?
No.
Okay. So I'm going to go ahead and palpate. And what I want to do, make sure also, like earlier when I was feeling anterior, I was checking to see if there was any kind of air trapping in the front, which there was no crepitus, there was no air trapping, as well as back here. So I'm feeling to make sure there's nothing like that as well. Okay. I'm going to feel all the way down to make sure there's nothing abnormal, any kind of pain. And the way I'm also going to check, I'm going to lift up your shirt for a little bit. Is that okay?
Yes.
Okay. So what I'm going to do is lift up, and what I want to do is I'm going to just check the expansion of your lungs, and so just so I can be at your level, I'm going to sit right here, okay? And right by the 10th intercostal space, I'm going to go ahead and pinch a little bit. I'm going to have you take a deep breath in, and I want you to relax. Exhale. And all right. Go ahead and take a deep breath in. All right, and exhale. As you see, my hands just went expanding a little bit as he exhaled, which shows good movement, good lung expansions. Symmetrical looks good too when he's breathing. I inspected, I palpated as well to make sure there was no air trapping, any crepitus or any kind of deformity as well on his lower and upper back. I'm going to do a percussion. So basically what I'm going to do is percuss all the way down. And I'm going to start from the top. And what I'm going to make sure is that that the sound is, it doesn't resonate. It resonates. I'm sorry, I'm putting this back up, okay? So I can percuss and go all the way down, okay? So I'm using both these two fingers. And I'm going to have you take a deep breath in and hold it. It's okay. Take a deep breath in and hold it. Okay. So release, relax your breathing. Okay. So I have this here as a marker, but I just want to maybe use a little pen and make a dot so that way I can mark down. Right in here was the last, and I'm going to have him do the same. And what I'm doing right now is I'm percussing and I'm doing a diaphragmatic excursion to see the difference of the inspiratory and expiratory breathing pattern that he has. Basically, it's the movement of the expansion of the feeling inspiratory and expiratory of the lungs as well. So I'm going to do it for both sides. So I'm going to have you do that again one more time, please. Breathe in and about the same area. Oops, like right here. Sorry. Relax, breathe. Almost about the same side right here. As you can see, this one's like right in here to his right side of the lungs, and this one right over here to this side. So now I'm going to go ahead and I'm going to have him try to see the dullness to the resonance. So I'm going to have him do that again, and I'm going to count back. Go backwards. Okay, so I'm going to have you take a deep breath in and relax. The dullness. I'm going to have you do that one more time, please. Relax, breathe. So I'm going to go ahead and auscultate his posterior lungs. We're going to auscultate the right and left. The right is a better way of listening to the right medial lung compared to the anterior. It's a much easier way to check on that side. So I'm going to go ahead and take a listen here. And if I can have you take a deep breath in, please. sorry. It's best for me to do. I'm sorry. And deep breath in and out. Take a deep breath in and out as I go through. Upper lobe is clear. Keep going. And one more time. And again, please. And again. Take a deep breath in. Deep breath in. Upper lobes, they're clear, no adventitious lung sounds were audible, no adventitious lung sounds to the mid, no adventitious lung sounds to the lower lobes. Thank you. You may turn around. Or the medial. Thank you. The apex, when I was listening to up here, was clear of the lungs in both bilateral area. There was no crepitus or anything like I mentioned, but I wasn't palpating in front and mentioning at the same time. Okay, thank you. Thank you for your time.
Thank you.